Hello, good afternoon. I'm Dr. Marianne Pinkston, standing in for the irreplaceable Ron Aaron Eisenberg for GPA Live today. Welcome. GPA Live is a virtual education series that is brought to you by the Global Pain Association, of which I'm a board member. I'm very thankful to be. And today we have a wonderful presentation. We have Christina Burke from Compassionate Cultivation here to talk about medical cannabis. So it's a very, it's a great discussion on the social implications and great therapeutic implications for patients with chronic pain. A little bit about GPA. The Global Pain Association is an association that strives to help patients and people and their families and caretakers with the chronic pain that, it kills people's lives. It is definitely an interference with their quality of life. And so this association was brought together to bring patients a source of education and resources, their family members and friends, and GPA does a wonderful job at doing that. They have also started a support group, the Global Pain Warriors, or GPA Warriors, and the support group is facilitated by me, actually, and it is on the first and third Tuesdays of every month from 7 to 8 p.m. We would love to have you and your friends and anyone who is involved with anybody with chronic pain, if it's you or one of your caretakers. So please join us for that. You can go to the website at www.globalpain.org and learn more, get the Zoom log. You can also email the association at info@globalpain.org. And we also ask that you consider volunteering, being a sponsor, or for donations. This is a great organization that is nonprofit, and we would love to have the support of all of you out there who would love to see us continue. And I thank you very much. So, no further ado, I'll introduce Christina Burke. She is with Compassionate Cultivation. And we will give the website for texasoriginal.com. And she, this is an association that works closely with community partners and doctors all over Texas to try to provide awareness and work with the legislation and bring medical cannabis to the world of integrative and then medicine and to try to treat patients for chronic pain and other issues, many issues, which she will discuss. She has her Bachelor of Science in Health and Human Service with and her focus on biological communication roles. She has her Bachelor of Science in Health and Human Science with a focus on biological psychology from the University of Houston, where my daughter went. And prior to Compassionate Cultivation, spent 17 years in investor relations and communication roles in the oil and gas industry and consumer products industry. So, Christina, welcome. We are so happy to have you here. You've got a great presentation. I'm looking very forward to it today.
Thank you for having us. Thank you for the Global Pain Association for taking the time. Thank you, Dr. Pinkston, for moderating. We're very excited to be here and share our information and raise awareness and education for medical cannabis, especially as it relates to pain management.
Absolutely. Well, this is a great association. Listening to you yesterday when we were practicing for this was so much information. I thought I knew a lot, and listening to you, I really learned a tremendous amount. So really explain Compassionate Cultivation and what you do and who you are and what you have to offer us.
Great, thank you. So Compassionate Cultivation is one of the 3 companies licensed under the Compassionate Use Program that was originally passed in 2015 to provide medical cannabis for qualifying Texans. Compassionate Cultivation is the only Texas-owned and operated licensee in the state to provide this medicine. Our mission is to create the highest quality medicine that changes people's lives, and it is changing people's lives. And our vision is to transform Texas through the power and truth of medical cannabis. A little bit about the Compassionate Use Program. It was originally passed in 2015 by the Texas legislature to provide medical high CBD, low THC medical cannabis for patients with intractable epilepsy only, with a prescription from a board-certified neurologist. Compassionate Cultivation received their license in October 2017. We opened our doors to the public in February 2018 and advocated strongly with the legislative session and legislators in 2019 to expand the program which they did. So the next slide, we'll go through what it expanded to. So as I mentioned before, it was only available prior to 2019 expansion for patients with intractable epilepsy. When they expanded this, they did several things. One, they added several qualifying conditions: all of epilepsy and seizure disorder, autism, multiple sclerosis, spasticity, terminal cancer, ALS, and incurable neurodegenerative diseases, including Parkinson's, Alzheimer's, dementia, Huntington's, some peripheral neuropathies. There's about 95 conditions under that list, and you can click on the slide or go to the whole list on our website. What it also did, the patient requirements stayed the same, which you must be a permanent resident of the state of Texas, and you must be registered in the Compassionate Use Registry of Texas, which I'll refer to as the CURT. But it did allow for prescribers, they must be registered and they must be board certified in a specialty approved by the American Board of Medical Specialties or the Bureau of Osteopathic Specialists. That removed the need for it just to be just a neurologist. So any board certified specialist can in fact write a prescription for this. Another thing the expansion did was remove the floor on the amount of CBD. And I won't get too much into that. It gets very confusing. But what that allowed us to do was create ratios that targeted specific conditions. And while pain is not qualified, a lot of the conditions that are qualified do have pain as a primary symptom. This right here, what you're looking at is a chart, and these are results based on clinical studies that show what ratios would target specific symptoms, that being a high CBD ratio or a balanced ratio. And that's what we create for our patients, are these balanced ratios. And I talk about balanced ratios because that is what's been proven and shown to help with patients with chronic pain or peripheral neuropathy, acute or chronic pain. So the next slide, just to kind of give an overview of our products. Yes.
Christina, may I ask you, what is the difference between consumer CBD products and our medicine? You mentioned CBD. What is the difference?
That is a great question. And it's one that there's not a day that goes by that we don't get asked. There's several things, but I'll hit the high level. We can get into more detail on our website too, because it can take the whole day and talk about this. But on a high level, they're all cannabis. Consumer CBD products are derived from hemp. The ones that you see all over at the pharmacies or compound pharmacies or gas stations, it's everywhere, is derived from hemp. Hemp and I will say marijuana, medical marijuana, are both the cannabis plant. The difference is the amount of THC allowed. Once it hits anything above 0.3%, is considered marijuana or cannabis, even though they're both the cannabis plant. It's a little confusing, but that's how we describe it. Anything up to 0.3% is considered hemp. Now, the difference with the products also is not only the amount of THC, which THC is the psychoactive ingredient in the cannabis plant, but there's tons of other cannabinoids and compounds that are within these that are naturally occurring in these plants. One of them being CBD, which is known, as we all know, to have a lot of therapeutic effects, along with THC and some of the other compounds. Another difference with the consumer products that you see, when you're treating a medical condition, you need consistency and purity in your medication. It's like going to over the counter, you can get Tylenol 3. That's kind of the example I use but if you're treating a medical condition, you want consistency and purity. Because the hemp products are not regulated like medical cannabis in Texas or other states, they don't have to have the stringent guidelines that we have to produce a consistent and pure medicine. And what that does is it brings around a whole nother set of issues. Now, they're not to say that the hemp-based consumer CBD or over-the-counter products are bad. There's a lot of good products out there. But there are a lot of bad products. One of them being you have to pay attention to where your hemp is sourced from. If it's sourced in a country that doesn't have the same standards, or even from a farm, then you can run into some serious health issues. Those being the fact that cannabis is a natural bioaccumulator. What that means is it's going to absorb anything in the soil, in the water, in the atmosphere of where it's grown, in the environment it's grown in. So if you're sourcing your plant, your hemp, from a part of the world or country that has toxins or pesticides or dirt that used to be, chemical soils, you never know, that plant is absorbing all of those chemical contaminants into the plant. And so that's what you're putting in your body. Now, again, there are a lot of good products and a lot of clean, good products out there, but there are a lot of bad actors out there. And that's what you have to watch out for.
So I know that, excuse me, I know that a lot of, patients will buy from, a local store, they see it on the advertised on the side of the road, big flag, they'll go into a shop, they'll go into, one of the local vitamin shops or whatnot. So you're recommending maybe to ask a, medical professional or go onto your site or look for those types of things.
Yeah. A lot of them, they'll have to have COAs, which are certified, oh my gosh, I can't even remember what I know what the COAs. Oh my gosh, I can't remember what for now, and I should because I talk about them all day. But they show the testing results by third-party test results. You want to see a third-party tester. You want to make sure. And real quick, you could drop to that slide, the Leafly slide, really quick. We'll jump to that real quick since we're talking about consumer versus medical. It's the one at the end with the big pie chart. Real quick, it was in the appendix.
Sorry, which is fine. We could hit it at the end.
Okay, we can hit it. Just real quick, we can jump back to that at the end.
Sure. I'll ask you. I will ask you at the end and remind you.
Another thing, and that just slide, and we can do the slide later, is what it shows is a lot of these products also, there it is, thank you, do not even contain CBD or don't contain the amount that they say. So you might say, well, I tried CBD and it didn't work. Well, if you're buying it from some random store that isn't a quality product, most likely it doesn't have any CBD in it, or it has very little compared to what it advertised, and you're just paying for really expensive coconut or olive oil. This study shows Leafly is a national recognized kind of source for cannabis, and they did a study over 47 consumer CBD or over-the-counter CBD products, and these are the results that only 51% had delivered the promised amount of CBD within 20% of a labeled dosage. If you need consistency and purity for a medical condition, you can't run that risk of not having that. So that's a long answer to a short question, but it's a very important question.
Very important. So thank you, Christina.
You're welcome. And we can go back to the product slide really quick. Great, thank you. So these are our balance formulations. So while pain, again, is not a qualifying condition yet, and we'll get to that later, a lot of the conditions that we are qualifying have pain as a primary symptom, including, as you know, peripheral neuropathy. So what we're seeing in our patients and clinical studies is that these balanced formulations that are what we're treating or seeing most success with the pain related to these other conditions. And the difference in these two formulations, I'll keep it very high level. There's a lot of information on our website under products as the amount of CBD. By law, we can only have right now up to 0.5% THC by weight or per milliliter. So each bottle has a certain amount of THC. All of our bottles, it's the CBD that varies. And the reason you want CBD is they affect different receptors in your body. The THC is the CB1 receptors. The CBD kind of bonds with the CB2 receptors, and that's also a lot of information on our website. But so your body, when you want CBD, is for like more anxiety or tics and tremors and different things of CBD, and you want the THC for the pain. But if you also are treating anxiety, you might want a little bit more CBD. So you get the 3-to-1, which has 3 times the amount of CBD as THC. Or if you're really treating acute pain or the peripheral neuropathy a lot of times and different things like insomnia and kind of appetite loss, you might want to go with a more balanced, which has the equal amounts of THC and CBD. And the reason that matters is because what CBD does is it blocks the effect of the THC. So if you're looking for less of the effect of the THC, then it balances it out with the amount of THC, because the CBD does block those CB1 receptors from absorbing the THC.
Christina, I know a lot of patients do a lot of gummies or eating or things like that. Is it better under the tongue and absorbed that way, or can you do that through your gastrointestinal tract?
You know, you can. Our products that I have shown on this slide, we have tinctures and then we have lozenges. We suggest, and with our chief medical officer, we worked really closely with our chief medical officer to create these formulations and dosing. And what she has told us and what we tell our patients is, when you get it in your mouth, under your tongue, or in your cheek pockets, it absorbs quicker and more rapidly. Also, when you introduce, and this is according to our chief medical officer, the liver or the stomach in, it might be a little bit of a delayed response because you do have to go through the liver or the stomach, and it might be a little delayed. However, we have a lot of patients that are on G tubes. So they just put it in their G tubes, and there's, it doesn't matter that much, but it's just a widespread belief, and from advice from our chief medical officer, holding it in your mouth. And that's why we did lozenges, because it's in carrier oil, and some people are sensitive to the carrier oil. So we created lozenges, but absorbing it in the mouth, we feel, and what we are been told and what we're being guided by, is that it's just more rapid and quicker effect.
Got you. Thank you.
You're welcome. Great. So this slide is talking about conditions and symptoms affecting most Texans. And this information was created by a company that put together an economic impact survey for this legislative session. And we can, like I said, we'll get to that in a bit. But it shows that these are over 19 million Texans suffer from these conditions or symptoms. And the ones in orange I've highlighted are the conditions most associated with pain. And so this is over 19 million Texans we find that could find relief with medical cannabis, and that a lot of them don't have access to them. If you go to the next slide, this shows the patients that we currently treat and the conditions listed. And in the orange, on the bars in the orange, are the ones that we are reporting pain as a primary symptom. So that previous slide shows all the conditions that could be treated and helped with this. This is then a much smaller amount of people that have access to this. So we're really lobbying hard. So this is from our actual patients. These are the number of patients we've seen up through February of 2021. And pain is a primary symptom in 5 of the approved conditions. And I say 5 on a high level because when you get incurable neurodegenerative diseases, which is a condition that lists a bunch, there's 95 conditions underneath there. I'm sure many of them is pain, but this is just a higher level. Over 75% of our patients are reporting pain as the primary symptom they're trying to treat, if that's in the form of spasticity or peripheral neuropathy, different things. Over 50% are reporting improvement in symptoms, and over 90% of these patients are seeking out medical cannabis as an alternative to opioids. So this, and I'm not going to go too deep into this because being, you guys are, well-versed in pain, you guys know more about this than I do. But, and also Dr. Pinkston, we talked about this, the opioid epidemic, what's going on in the world. Everybody's well aware of it. It's all over the news. But we're looking at this, and when we presented the Texas legislature, like other states have, as an alternative to opioids. And in the slide on the right, you can see the little bar chart where there is a percent in states that have a cannabis program, whether it's recreational or medical, the percent of people abusing opioids is much lower. That seems like a small percentage, but if you look at the overall population, that is, and that's just starting to gather the information. And as more states come on board with either some sort of cannabis program, then I believe, and a lot of people in the studies are saying this is going to continue you'll see a reduction in opioid abuse and addiction. It says in the states with cannabis programs, on the left, you see the chart where it says, 14.4%, or, average 14.4% fewer opioids are being prescribed in states with a cannabis program. There's, less mortality. There's a reduction in overall use, and users are reporting that they're getting completely off their opioids when using a medical cannabis or cannabis product. This slide talks about, is very specific to Texas. And one of the highlights, I put this also came from the economic impact study, is opioid crisis in Texas cost the state over $20 billion. That's a huge amount of money that is, with treatment programs and just the long-term effects of the opioid crisis and short-term effects, the Medicaid reports. So this chart, again, shows kind of a breakdown of how the opioid misuse really affects Texans. And this is very important because when we get to the slides that are coming up about the legislative, this is what we are presenting as a company and as an industry to Texas legislators in hopes that we can give this to people with chronic and acute pain. So this opioid crisis continues to not be an issue in Texas or the United States.
That is an unbelievable number. I had no idea. And I'm knee deep in this.
We just got this report a few months ago, and it was staggering. I mean, there's 16 pages just addressing opioid use. I mean, we don't have enough time to go through it all, but it's staggering the amount of money it costs and just the overall, just the deterioration of people's lives due to this, long-term effects to the children and I mean, just it's amazing.
Agreed. Thank you.
So we get a lot of questions, you know, it seems very scary. How do I participate in this compassionate use program? It seems like it's a scary thing or it's overwhelming. It's really not. It's actually very simple because the doctors and the dispensaries do most of the work for the patients. So the first thing we always tell people, talk to your doctor. If he's board certified or he or she's a board certified specialist, you know, that's great. Talk to your doctor, be honest. There's a lot more information out there. We're always around that help educate, but the stigma is slowly being removed as more and more Texans are talking about this, and it's becoming less, you know, scary to talk about cannabis because people are seeing relief. So talk to your doctor, be honest with them. Your doctor may be unwilling or unable to prescribe this. There's several reasons. One, it could be the hospital system is because of the federal illegality of cannabis, are unsure if they want to support the program. That's okay, because if your doctor is unwilling or unable, we have a team that matches patients up with doctors for the sheer purpose of receiving this medication. The great thing about that is you don't have to terminate your relationship with your existing physician to get this medicine from another doctor. You can continue to see your doctor for whatever you have that relationship with your caregiver, you know, whatever you need. And you can go to someone else to get this prescription. All we ask as the prescribing doctor and the dispensary is make sure you communicate with your doctor that you are getting this medication, because there are some interactions, you know, they need to watch for interactions with other medications that you're on. So talk to your doctor, be honest with them, but don't be, you know, don't feel deflated if they're not willing or able to write this prescription. We can help you. We have a whole team that's what we do. There's doctors all over the state that provide this treatment, but also there's telemedicine, especially with COVID telemedicine. We have doctors, if you live in Amarillo and your doctor won't prescribe it, there's a doctor in Houston that can see you via telemedicine. So it's a lot easier than you think. Once the doctor sees you, qualifies you, or approves diagnosis or qualifies you with your existing medical records, or they diagnose you, then they put your prescription and your treatment plan into the CERT, which we spoke about earlier. Once they do that, the patient usually contacts our dispensary, either on our patient portal online, or just calls the dispensary and says, hey, I have a prescription. I saw Dr. So-and-so. We verify that prescription in the registry, and then we take it from there. We walk you through the entire process. We walk you through your dosing. We translate the doctor jargon for you. We tell you how to take it, where to store it. There's no question that we can't answer. The only thing we can't give is medical advice. But again, once you're in there, we walk you through the entire process. And then you just schedule a pickup or delivery. We deliver statewide. We also have pickup locations statewide. So it's very simple actually for the patient. It's just finding those doctors to prescribe or getting your prescription, talking to your doctor, but don't be scared. And if you need advice on how to talk to your doctor, we have a team that will walk you through that and provide you with the information needed to go and, you know, feel educated and feel confident about talking to your doctor.
Christina, is this medication covered by insurance?
Unfortunately, it is not. It's still federally illegal and therefore is not FDA approved. So most insurance companies, all insurance companies, they don't cover it. We haven't come across any insurance companies that are even willing to talk about it. However, if you have an HSA or FSA card or plan, you can get reimbursed through that plan because that is a self-funded plan. But unfortunately, insurance does not cover this.
Is it very expensive?
You know, it depends on your dosage and the medication you're on. Our balanced formulations are less expensive than our high CBD. CBD is very expensive to make, especially the quality and purity of the product that we create and produce. But it really depends on your dosage, how much you take, how much you need. It can run anywhere from $75 a month, depending on your dosage. So that's a really hard question to answer, but it can get expensive. But because of these balanced formulations, and especially for pain, needing the balanced formulation, it's a less expensive product.
I think patients Also need to realize too the expense of what they are doing to make up for being in pain.
Yeah.
The amount of vitamins or medications they buy, copays, or other doctor visits, and all the things that go into their chronic pain, maybe loss of income. So when you're out of pain and you're feeling good, then you tend to up your level of income and have more freedom and ability to afford things like this. You have to kind of balance the pros and cons there.
Correct. We also work with organizations. Some of them right now, majority of them are pediatric, like the Shannon Foundation, and it's geared toward pediatrics. So pain is a lot of times a predominantly adult condition. But what we are trying to do actively is partner with organizations to create what we call a compassionate use patient assistance program. And we put if you want to donate or help a family, donate buttons, and we're trying to do more of that and help raise awareness. But also sometimes there's organizations that we have partnered with that help offset the cost for patients that can't afford it, and we actively look for organizations to partner with to do that.
Wonderful. That's great. Great information.
So I did add this slide just recently. I know we had originally scheduled this before Snowpocalypse, and after that, we decided to get back. We had to look at what bills were being filed to expand this program, and we have now decided we are backing Texas House Bill 1535, which is being written and authored by Representative Stephanie Click, who wrote the original Compassionate Use Act in 2015. And this is what the bill is asking for. And this is the high level of what they're asking for. There's a lot of things that we're, as an industry or dispensaries, are asking for to help us with logistics. But as it affects the patients, what we're asking them to do is expand the list of medical conditions to include acute and chronic pain. This is the number one goal. We tried to get it on the bill last year. It wasn't accepted. It's unfortunate, but we are actively working very closely. And that's why we had this asked for this economic impact study to talk about the opioid crisis, because it's important and it's real. So acute and chronic pain is our number one. We're asking to expand this for that. Also, all stages of cancer, because right now it's only terminal cancer, which is confusing because the oncologists that we work with are like, well, all cancer is terminal. So we're kind of asking for a little leeway with the verbiage and not have terminal cancer. And a lot of times, pain is associated with cancer. So, if you don't have what they consider terminal cancer, then you don't get access. And it's really not fair because any cancer can be terminal. Life is terminal. And then PTSD. We also try to get this on the bill last year. It was not accepted, but PTSD for our veterans especially, it's a very real thing, and they are finding there's a lot of anecdotal evidence and support that shows veterans that are using cannabis, whether it's recreational or in other medical states, are seeing great improvements in their life. Depression, anxiety, the PTSD, it's life-changing. It really is. And I don't use that word life lightly, like those words life-changing, but it is, and we're seeing it in our patients. I recommend that you guys go and look at our testimonials on our website. They're very, very powerful. Also, it'll grant access to patients with medical conditions approved for research programs, which is very important. And until we get research programs, we will not get insurance coverage on this. We will not get FDA approval. So that is very important. It'll also allow access to patients with debilitating medical conditions. That'll be designated. Those conditions will be designated by the Department of State Health Services, and also establish research programs, again, to go back to helping to get this covered by insurance. We also are asking to increase the THC limit to 5%. While the 0.5% is showing effective, and a lot of patients will never have to probably go above that, having an increased THC, especially for patients with pain, is very important, because in other states that have a broader medical program with higher levels of THC, the people with pain are reporting significant improvements, completely getting off their opioids, and a reduction, if not cessation, I can never say that word correctly, sorry, of their pain. So
Christina, was that, I'm sorry, I don't know where to interrupt you, Donna, but such great information. We had a question from somebody on the Facebook thread. Does it look like Texas will get an expanded medical program this year?
We are very confident about that for two reasons. One, because of the opioid crisis, we know that the legislators are paying attention, and they're willing to listen. They're open to listen. And before they were like, no, we're not going to expand this. They are. So we're very confident we'll see it expanded, especially for pain. Also with COVID, people are home doing their research. They're getting behind things. They're doing some research, and also with telemedicine and with COVID shutting down the state, this is a huge economic boost to the state, or potentially could be a massive amount of tax revenues that we're seeing in Colorado. You can Google it and just see for yourself. So we're very confident that we will see an expanded bill passed. Hopefully what we want. We'd love to see all these things. We don't know if we'll get them all. We feel very confident about chronic pain, but the legislators are listening and they are open to hearing it, especially because of the opioid crisis.
One step at a time.
One step at a time. So a lot of people ask us, how can we support? How can we get involved? How can we help? So we created this page on our website to help people. This is how you can get involved. One of the most important things you can do is send a letter to your representative. And there's a link where it says click here to get involved. You can click on that. It goes right to our website. It has Find My Representative. It'll tell you who to write. We also provide a template that you can write your own letter, or you can, use our template, but it's like, tell your story, why you believe or need this to be, accessible to patients with pain or family members with other conditions that aren't covered. Or if you're a current patient that you have a condition that pain is a symptom that you're seeing relief in, tell your story. There's nothing more powerful than these patient and human testimonials. When they hear the stories from people actually suffering from these conditions, it's very powerful. So we encourage people to go on the site and subscribe for updates, share your story. I think we have a really wonderful, our marketing team has put together such an informative website. There's a ton of information on there. The testimonials are on there. So please, if this is something you believe in, get involved.
Information. Absolutely. I've enjoyed this so much. And you actually yesterday had a slide that discussed that whenever this was removed as an acceptable form of treatment, I think maybe back in the 1930s or 50s or so.
1970s, Nixon, the Controlled Substances Act.
Nixon. Okay, that's what it was. Sorry about the dates. But what it caught me is when you said that it was actually the AMA that was resistant to that and stated it should be maintained and should continue as a form of therapy.
They said that it did no harm. They couldn't prove that it did any harm, and there was no reason. So it's just interesting how back in the 70s when this was passed and made illegal, that the AMA was the one saying no, this is something we should look at, and it's it's unfortunate.
It is unfortunate. And I know so many doctors have trouble accepting, and opening their minds to this now, even though it was the AMA that was supportive. So, if your doctor is not willing, you mentioned, and if your doctor is not willing to or open to it at this point, or maybe they're not able, you don't have to switch your doctors, but you do have access. So, the texasoriginal.com, that's the great source. Start right there. And it looks like you've got it made. That's great. Nice.
Well, actually, also one thing I didn't mention yesterday, but I would like to put this out there is we love to give tours of our facility. We love to show how this medicine is made. Whatever you think you're going to see, you really walk in and it's so impressive, and to watch how the care that's put into this medication. So if the GPA, the Global Pain Association, would like to put together a tour and bring some of their members, during COVID, it's been kind of sticky, but now we put on masks. We're kind of coming out of the woods a little bit with it, but if people are comfortable, we love to give tours. And you'll wear a mask, you'll suit up, you'll have to wear kind of basically a hazmat suit almost, because we have to be careful with pests, because we don't use any chemicals or pesticides. So everything we do is natural. We have to be really careful. But we highly encourage groups like yours to come in. We can do a support group there. We can do a presentation, but come and see our facility. It's certainly time well spent.
I bet. And that sounds wonderful. So looks like a great idea. We'll have to put that together. Honestly. Thank you. Absolutely so much. That was great. So, something like this is got great implications. So we are going to have to look forward to the future and hope that that one step at a time becomes a farther walk every minute. Well, thank you so much for joining us today, Christina. So much.
Thank you. Thank you. And if you can come to the website, answer any questions. You can email me directly. You feel free to share my email. Call if you're looking for a doctor. Click on our website, find a doctor. Rodrigo is who will answer you, and he will guide you through the entire process. So thank you for having us. It's great. I really appreciate it.
Absolutely. Well, great. Well, I know everybody is wondering what is up next for GPA next week. So you should join us every Saturday at noon at Global Pain Association. We are on Facebook, and we are at globalpain.org. And that's where you can look to find how to join us and watch our programs. And up next week, imagine that Dr. Marianne Pinkston will be presenting neuropathy and restless leg syndrome. I'm going to really enjoy this talk. This is near and dear to me too. Not only do I have rheumatoid arthritis, but I also have neuropathy. Lots of things going on. So I would really like to share this with you, and I hope that you will join us. Ron will be back and steal this honor from me, so I will gladly give up the chair and let him, the microphone, and let him have that again. And we'll be excited to have you. So please join us. Thank you for joining us today. If you have any questions, please email us at info@globalpain.org. And again, thank you to the board of directors and all for having me on today. Thank you. Have a great Saturday.